Evening. Thank you everyone for joining our webinar on healthcare communications with Sangoma UC. So for those of you who are regular attendees of our webinars, you know we have to give you a quick weather report from our international HQ in Wokingham in the UK. It's cloudy, a little bit chilly, but it's not too bad a day. And you know what? On that note, I haven't introduced myself. My name is Shan Sood. I'm the International Marketing Director for Sangoma. I'm going to hand over to my colleague, Justin Tolsmar, who, please be nice to him. He's a little bit under the weather, but he's a trooper and he'll barrel through. Over to you, Justin.
Thank you very much, Jan. Thank you for that introduction. And welcome indeed to the webinar. Good morning, good afternoon, good evening from literally all over the world. I have the pleasure to have attended and hosted quite a few webinars in my time here with Sangoma, and it's always brilliant to see that the attendees literally from every corner of this beautiful globe that we have. It's always a pleasure to reach out to people, even in places where I've never been, but I'd love to go. So I might hook up after this webinar and reach out and see if I can get any tips from some of you guys where my next holiday destination will be. As Sean mentioned, I am a bit under the weather, so I might jump on mute halfway through a sentence because I start coughing. So actually, funnily enough, I might need some healthcare myself. So it's a bit ironic that I'm doing this webinar. But without further ado, let me jump into the agenda. Okay, this is what we're going to talk about. This is, first of all, this is not a technical webinar. Let me get that out in the open first and foremost. We are talking about what healthcare organizations need, what is important to them, and what Sangoma Unified Communication Solutions can mean in that place. This is not a one-size-fits-all. Healthcare organizations are sometimes one of the most complex organizations that exists. So we hand the communication tools for organizations in healthcare. We do not promote any, let's say, healthcare management systems, healthcare information systems. We don't have an off-the-shelf package of our solution and third-party solutions to have just a plug and play for within the in the healthcare organization. This is how Sangoma sees what is important for a healthcare organization with regards to communications. So get that out of the way. So you can see the agenda. Why is it important? So I'll explain it a little bit. Sangoma UC and I'm going to touch 5 areas, 5 topics that we identified, and that this is not by far every single topic, but if I would go into in that much detail, we would probably have a webinar that lasts at least 2 or 3 days. So we've chosen 5 topics that we see are high on the agenda for every organization, and most of all also for healthcare organizations. Then I'm going to touch on some examples, so some case studies, some installations that we've done all over the world. Of course, we do a conclusion, and you have questions, and that brings me to the bottom right. We have the questions box. If there are questions, please put it in there. If we have enough time, this webinar is scheduled, I think, for 30 minutes. If there is enough time, we will handle those questions. If we don't have time, we have your contact details. We will reach out to you personally and discuss that question and answer that question for you in real time. So let's go to the first slide. Why modernize communications in healthcare? Well, yeah, good question. Hospitals and healthcare organizations those are organizations that never sleep. They're always there. They always need to be available. It would be something if You have a broken leg, you go there on a Sunday afternoon or call them and say, no one picks up because it's a Sunday. No, it doesn't exist. So hospitals are always open. That also means that they have to be reachable at any given moment, 24/7 availability. Missed call can be the difference between a timely solution, a timely care, or a poorly managed emergency. Uh, what we also see in hospitals, and I see it here myself locally in our big hospital, there's a lot of legacy equipment systems still in place, which were meant for purpose 20, 30 years ago, but in today and age, um, they still work, but have very basic functionality. Most of them come with high maintenance costs. They are very inflexible with regards to how to set up things, how to configure things. And also, if it's there, it's very clunky, but integration with other solutions, other tools. Um, and then I will discuss that in one of the future slides. Um, what are the thing that, of course, is also nowadays, especially since 2020, very important is mobility. No one, or you notice people don't work in a set location always anymore. So you need to be mobile with regards to where you work. That can be inside the building, but that can also be cross buildings. Those kinds of things are very, very important, which are virtually impossible to do with legacy systems, which are very expensive. Um, Integrations, for instance, so to it would help reduce human error. Uh, if you have a proper integration, then the person doesn't even have to say its name, and the systems come up, so you can't mistakenly type the name and get the wrong information on the records. So these are some reasons why healthcare communications need to modernize. Here in the UK, we have the added thing, and I know there's other parts in the world. I know a lot of Europe has gone already to a fully VoIP-based telephone infrastructure. Here in the UK, we're not there yet. We still have analog infrastructure, which is offered to us by British Telecom and Enreach, which is the provider. Um, and there's still legacy systems connected to it. First of all, it's expensive. Second of all, it's going to be phased out. The date here in the UK is January 2027. And I've had conversations with people where they say, specifically in healthcare, and you don't necessarily have to think in hospitals, but think care homes, nurseries, dental offices, a lot of old infrastructure and old um, connectivity. So the telephone line itself is still present there. If those organizations don't change before January 2027, they won't have any calls coming in or out anymore. So that is a specific need. And I don't know all the dates and what the planning is for the rest of the world, but this might sound familiar to you for your part of the world. We can help in various scenarios to mitigate that challenge that is coming. So yeah, please always reach out to your Sangoma account manager or distributor. Okay, what do we have here? You see here, what I'm going to do is I'm going to explain 5 key functionalities, if you could say, that are important for healthcare organizations, which can be solved, if you can say it like that, with Sangoma Unified Communication Solutions. The Unified Communication Solutions that we talk about here is SwitchVox and PBXact. Um, it's not one or the other. It depends on, first of all, what a customer needs, and so what their requirements are, and also what the preference of, for instance, resell the knowledge is, or also it depends on. So I'm not talking about one or the other. The functionalities that we have fit for both. Both can be deployed on-premise. Both can be deployed hybrid, so a mix of on-premise and cloud. And of course, it can be deployed in the cloud. That can be your own cloud or it can be our cloud. Ask your account manager for the options that are available. Okay, scenario one or functionality one. Multi-site communications and remote extensions. So one of the key features that we have at Sangoma is we are able to connect multiple locations under one single telephony telecoms infrastructure. So what now happens, especially with legacy systems, those legacy systems, they're all separate. That are all separate systems. They're not connected to each other. So if you have 5 sites, you have 5 systems. They are not connected as one system. So if you call from one site to another, that's not internal calls. That's basically external calls, which can increase the cost of your telephony. With our system, you can actually have, for instance, those 5 sites act as one site. They're all on one system. That significantly reduces communication costs between locations. You don't need external phone lines for internal calls. As I mentioned, my apologies, take a sip of drink of water. One of the key things also is the internal directories. They can all be seen with permissions, of course, of the admin by each other. So it makes it more efficient for people to work, to find people. Most key thing is, of course, it reduces costs. You're all on one system. It also gives you the ability that you're not tied to a desk anymore. So if you have multiple locations that you work on and you want to use a desk phone, you can use the hot desking functionality. So log in one location, log in another location, and you still have your own settings on your phone. It all helps reduce the difficult parts of it. So it reduces the complexity. That's the word I was looking for. It reduces it, makes it simple, makes it easier, so people don't have to think about it. Just log in and out. Increases the efficiency of patient care, of course. Also, there's also one repository of call recordings, which is a topic that I'm going to discuss in 2 slides. Call queues and intelligent routing. Imagine a hospital switchboard, Monday morning, patients calling to schedule appointments, family members wanting reports, labs need to confirm deliveries, all that kind of thing. It's busy, always. Traditional system, very basic. They go into 1 or 2 points in the beginning and then moved on. With that much traffic coming in, it gets mixed up, it falls over, it clogs up, there is a queue, people can't reach it, they have long waiting times, all that kind of stuff. Sangoma Unified Communications use call queues, intelligent routing. So with IVRs, with call queues, calls are being routed to the department, to the people, to the specialities, to wherever it needs to be without going to that initial single point. So it's being routed there. You can even have it that if you have, for instance, suppliers like Pfizer for medication, all that kind of stuff, if that number is recognized, it automatically moves that to the pharmacy part of the organization. They don't need to go through all the IVRs. It's all part and parcel to make it more efficient, to have shorter waiting times, and to make sure that not one person is overloaded with calls that they can't answer and constantly have to transfer. You can also have it routed based on time, day and night. At night, normally there's less staff. There's always staff, but there's less staff. So you can have time rules in there. So you say, okay, during the day, it goes there. During the night, we'll have other routes that it goes to. It reduces stress for the people in the hospital, but on the other hand, which probably is even as important, perhaps even more, it improves patient experience. They don't want to wait for hours and hours and hours, or even 10 minutes, 20 minutes, then get a person on the phone and saying, oh, yes, I can't help you with this. I need to put you through to that department and go through the same process again. With intelligent routing and call queues, this can be solved. And of course, Sangoma Unified Communications has this built in as standard. Next point, integration with healthcare systems. This is, of course, something that's can be vital. It definitely increases the what do you call it? The uh, flexibility. It improves the patient experience. Modern hospitals can't be disconnected from the communications can't be disconnected from the digital ecosystem. Um, its ability, Sangoma UC has the ability to integrate with existing clinical systems. We're talking about hospital information systems, electronic medical records, even medical CRM platforms. So what does this mean? When a call comes in, patient calls, the system can automatically display the patient's records. And of course, GDPR and healthcare rules decide what can be shown on the record, basically on the person's telephone number. This saves time, but it also reduces the margin of human error. Uh, it's you can like I first mentioned also we with the intelligent routing then also involved, it can actually um, based on certain parameters what's in the healthcare system, it can automatically route a call to a specific department. If you see that a patient is a patient from the physiotherapy department, based on the information from the hospital information system, that call can automatically be routed intelligently to the physiotherapy department instead of having to go through an IVR. Uh, it increases staff productivity, reduces process duplication. Sorry, my words are not coming out today. I hope it doesn't bother you that much. But this is what you see everywhere and every day. With Sangoma, you see solutions. All these systems can be integrated with our telephony system. Do we recommend healthcare systems? No, because who are we to say which healthcare system to use? We give you the communication tools to connect to those systems for the patients and the staff in the hospital to have the most positive and effective experience with regards to communication. Because communication is still vital important there. Healthcare and hospitals do not work via text message. Phone calls are the vital part of communication. So keep that in mind. Come to the following points: call recording and advanced reporting. In a hospital, every call, of course, counts. But if you don't fully understand the message that's being said, uh, a call recording can be sometimes vital. So, analysis of call recordings, and that actually brings me to the last bullet of this slide. Sometimes analysis of a call recording can be crucial with regards to what was actually said. That can be in the case of if it happened something negative, but also with regards to quality control, training purposes, all those kinds of things. With our solutions, you can record all calls automatically. It's standard, doesn't cost anything extra. There's also an option to do it manually. Uh, so you press a button on the desk phone or in the desktop phone. You toggle a switch. Don't know how to better pronounce it, but it is vital sometimes. Of course, you don't want to have to use it for this reason, but it can also serve as evidence in the event of a complaint or a claim by a patient or family member or whoever, a supplier. That can be evidence to help the hospital, but it can also be evidence against the hospital. So it works for you, but also against you. But transparency is key here. Then the advanced reporting with both solutions, you have very detailed reporting. So you can actually analyze and see which departments, which areas, which times, which dates actually are getting the most calls and why. The why is, of course, something that we do not necessarily register. We register the fact. The register the fact is that at day X, at X time, the amount of calls always spike. There's a trend every single week at that time. So then there is an opportunity to analyze and investigate why that is. Perhaps it's because the hospital sent out a newsletter or there was something else that is going on. They can then anticipate that and see if they can mitigate having those calls better spread over the week or over the day. If you don't have that reporting capability, you won't never ever be able to analyze those stats. With Sangoma, you see, no matter which one it is, you have that built in. The data is there for you to analyze. Last point that I want to mention over here is transcription, and that comes back again to point number 2 here. In Sangoma, you see there is the option to transcribe voicemails and call recordings. And that can be done in multiple languages. So that, English is the main language, but we have Spanish, we have German, we have Dutch, and trust me, I tried it. I've experimented with the tool. Perhaps you have watched the Scribe webinar from a couple of weeks ago, which I hosted, that was specifically about this topic, not necessarily in a healthcare setting, but it can be vitally interesting to see. There's even, and in the next webinar, I'll try and show it. I forgot to mention something. If there are certain trigger words in a certain conversation, an automatic email can be sent to a manager or a quality assessor or whatever. And in hospitals, that can be vital if certain keywords are in a call recording. It can be an emergency. So automatically an email is being sent out to one of the supervisors or a person that has or can monitor that. So it all increases the level of care that those hospitals can give, analyzing of the quality of the people that will respond to phone calls, the most asked questions by patients that call into a certain department can all be analyzed with the transcriptions of, for instance, call recordings or voicemails. What's the most common topic of voicemails that is being? It's very difficult to do that from audio. That's then a manual exercise. If you have a transcription of that call recording in text, you can do very easy analytics on text. So keep that in mind. Sangoma UC gives that option to make healthcare more fluent, get better analytics also to even improve their services to their patients and the community. Of course, because healthcare is vital in organized or in the community. You can't have it fall over, shut down, doesn't work anymore. Yeah, wait for a couple of hours. We're trying to fix it. There's something wrong, or we had let's say a network failure, or the sockets switch blew up and now it doesn't work. Can't have that happen. Communication always needs to be there. We can give you high availability on your telephony. At the moment something happens to X, it goes automatically to Y. Same settings, telephones register again. It's not instant, like I said, okay, it falls over and within fraction of a second it's there, but normally it takes 1 or 2 minutes, it's there. You don't have to do anything manual. It all does it automatically. So there can be hardware redundancy, that can be cloud resilience. This works for on-premise, for cloud, this works for hybrid situation. Doesn't matter where it is. It's a vital part for a critical organization like healthcare to have the high availability available, and of course disaster recovery, so backups that are being put back. So this is what Sangoma can give you. As I mentioned, these are the 5 points that I wanted to talk about. I'm not going into detail, especially not technical detail. That's, if you have questions, that's why we're here, because every situation is unique. I notice already that I'm babbling again, and I'm taking a lot of time. And Charlotte's probably now giggling in her office and shaking her head, saying yes. Real life examples. Okay, let's go down here quickly. These are actually all Sangoma customers, and this is definitely not all of them, but we just mentioned a few. Sean, oh no, let me have a look myself. Because I saw on the list that we had a reseller of ours that registered, and I wanted to give him a shout out, but I'm not sure if he actually made it here.
Yeah, unfortunately, it doesn't look like he managed to join.
No, okay.
But,
For your information, for all the other attendees, one of the cases that I had available, which is not mentioned on here, was actually done by that reseller. So it's been a while ago, but it was I thought, oh, that's nice to see that he's here on the webinar. So case one, for instance, Central Hospital, multiple critical areas. They implemented Sangoma UC to improve communications between the emergency department, surgery, and the lab. Call queues, smartphone, mobility. They were able to reduce emergency response time by 40%. That's critical. That's life-saving. That's the difference between making it or not making it. So a specialist could be reached anywhere in a hospital. Case two, laboratory network 5 locations, thousands of dollars per month for internal communications. That's here, there we go. You say it already, because they had 5 different systems that weren't connected to each other, so it wasn't seen as internal communications. With Sangoma UC multi-site, they centralized all their internal traffic onto a single platform, so they saved a lot of time. Private clinic, they integrated Sangoma with their appointment and medical record system. Today, when a patient calls, the system automatically displays their information, reducing admin errors, improving the experience, because the front desk already knows who's calling and the likely reason for the call. Case number 4, audits and quality. No, that's number 5. Okay, I have had dental clinics. This is actually here in the UK. It's a unification of 11 sites. Again, 11 sites, 11 different telephone systems, not connected to each other, not being able to find each other in the internal directory, but using an external contact directory. Sangoma used Sangoma solutions together with an integration into the patient management system, unified the communications for this group of 11 sites, which was one company. This was purely done in the cloud, and they're still one of the most happy customers they have. The way we've set it up over there, um, it's night and day compared to the previous setup. Um, Hybrid scenarios. So I haven't mentioned that yet. What we can do is we can do a mix of on-premise and cloud solution. If you have, for instance, a hospital that has a separate office system that's or an office building that can be in the cloud, that prefer to have cloud solutions, that can be done. But if you then go, for instance, into the hospital itself, that needs to have site survivability, as we call it, we can put an on-premise solution there, connected to each other, pair it to each other. So again, it looks like one system. The example that I did want to mention, it's not on there, which I referred to with regards to the reseller that was registered here. That was not necessarily so much about our unified communications solution. Sangoma can help within healthcare with many different solutions. We focus today on only the UC part. We can also do it with helping extending the lifetime of existing legacy hardware, getting it ready for the connection to VoIP, which means that a hospital does not instantly, immediately have to rip and replace their current infrastructure with the phones, with the telephone lines, with all those kinds of things immediately out of there to be able to get ready for the switch off that is specifically coming here in the UK. That the date we know, but that can also happen all over the world. If you have, I'm not going into specifics. If you have any questions with that regard, please let us know. Contact your account manager, contact one of our distributors, and they'll can help you, or they'll reach out to us so we can answer your question. So that's the key thing that I want to get out of here. And as you can hear, there's in the background calls constantly ringing. Now it's gone. And let me go to, this shows this is live, guys. Conclusion. As you saw, hospitals, they are critical. They face unique demanding challenges. Communications is a vital part of hospital of hospital running. It's not just a basic tool, it's a strategic tool. It's a vital tool for them to communicate, to be communicated to. So, but it needs to be ready for the 21st and preferably the 22nd century. It's not just Sangoma Unified Communication. It's not just a basic switchboard. It's a platform. It's a platform that gives you so many options to uh, um, make the work more efficient, make the communications flow more efficient, make them more resilient, make them more available wherever you are. Mobility is one of those kind of vital things. What does it do? It improves care. It improves, it reduces errors. It optimizes the resources that hospitals have available because they don't have enough staff already as it is. So as I mentioned, we have real cases. If you want to know more about the details of those cases, please reach out. If you want to have a demo about one of the solutions, please reach out. We can show you that. We can't show you the integrations with the healthcare systems. That is something we need to do on an opportunity or on a case-to-case basis. We do not have access to all the healthcare systems around in the world, and we don't always have the knowledge. But please reach out and we can always go into communications with those providers and see if we can set up a demo situation for that. Now, as final thing, do we have any questions?
Yes, we do. It's my turn to cough. I mean, you've managed to pass me the cough on through the walls of the office. The first one I can actually take, it's can we get some more information about the companies in the examples you gave? Yes, as Justin said, they are actual real life case studies we do, and the customers and healthcare providers are, we've got all the names and stuff. Just reach out to me and I'll give you a link direct to who they are and more information about that. The next one is about integration, and I'm going to throw this to you, Justin.
Yes.
Excuse me. Can PBExact and Switchvox integrate with CRMs like Salesforce or Zendesk or etc.?
Yes, yes, and yes. Yes, that is possible. We can integrate with those CRMs. Salesforce, for instance, that's natively out of the box. So it also depends on what level of integration you need. We have in both systems have APIs that help you with more detailed integrations. Sangoma also works with third-party middleware organizations and is in the process of working even closer with some of them. And those are middleware organizations that have, let's say, a pool of systems in their network that they've already readily made connections to, that then very easily and simply can be connected to the telephony system, so you can get the information out. But again, it's not a simply off-the-shelf thing, the integration. What we always ask is what level of integration is needed, what kind of information needs to be able to pop up and go in between the both systems. Talk to your Sangoma account manager, talk to your partner. We can connect a sales engineer to that question and come up with a solution. And if it is a question and we can't do it, we will be the first ones to say, to save you the time. But I have not come across many things, many questions that we weren't able to do.
Yeah. We've got a couple of more which do delve more technical, and what I will say to that is, guys, as reach out to your account manager, or there's email, global sales, reach out to me or Justin, and we'll put you in touch with the right person. And yes, we definitely can help with proof of concept. That is no issue. Come and get a demo on how it works, and we will hold your hands through this and show you the best solution, whether it's PBExact or Switchvox or something entirely different. We are happy to, our job is to get you the best solution, whether it's cloud, hybrid, on-prem. And I want to just say a well done to Justin for surviving through that, and because I know you've not been well, but a true Sangoma trooper, and you've managed to go through it all. And for everyone else, yes, we will get back to you one-on-one with the remaining couple of questions, but just want to say thank you to everyone for taking the time to spend with us this morning, and we will hopefully see you soon at the next one. Final
Thank you
words,
very much,
Justin?
guys.
Yeah.
No, thank you very much. It was a pleasure. I love doing it. And yes, I had to hold back the cough a couple of times, but it's all in good cause. And yeah, thank you for joining. Reach out, globalsales@sangoma.com. Any questions, we'll answer it. And it will be or your local account manager or potentially me that reaches out, and we can have a discussion. But yeah, please come and ask the questions.
Thank you. Bye-bye.
Bye-bye.